Can I eat gluten if I've been diagnosed with Hashimoto's? It's a big question, and although it seems simple, like most things in health, it can get a little complicated. In today's video, I'll teach you what the research says in regards to gluten and Hashimoto's, I'll tell you all the ins and outs of testing, and I'll help you identify what your tolerance is for gluten. When it comes to the absolute best information for natural support for your thyroid gland, make sure you subscribe to my channel and don't forget to hit the bell. That'll let you know every time I release a new video, each and every Thursday. I'm Dr. Bodle, and over the past 5 years, I've helped patients each and every day improve their thyroid symptoms through natural means and without the use of drugs and surgery. This allows me to determine precisely what people should and shouldn't be eating, like gluten. Let's get into it. So I've been really excited about getting a chance to make this video because not only are you going to get a ton of great information, but it will also blow the lid off of a lot of misconceptions out there, and there is some bad information when it comes to gluten and Hashimoto's. But let's first start by jumping into the research. So when we look at the entire body of literature, things are pretty clear, and this is not something that's still up in the air. There's a clear correlation between gluten sensitivity and Hashimoto's. And in fact, some of the research papers will go as far to say things like, if you've been diagnosed with Hashimoto's, then you should automatically be screened for celiac disease and you should adopt a low gluten style diet. So right away, this is where things can get confusing because if the research is suggesting, well, if you have Hashimoto's, you should go get tested for celiac, it makes people think that you still might not have a problem with gluten. You have to go get the additional testing and see if that's positive or not. But that's not the case. People can have gluten sensitivity and thyroid issues and not necessarily have a positive celiac test. So make sure we're clear on that. Yes, it's true that some people with gluten sensitivity will develop celiac, but that's not the case for everybody. So just because the celiac test comes back negative doesn't mean that you're necessarily off the hook when it comes to your Hashimoto's. There's still a strong likelihood that gluten is causing a problem for you. But I know what you're probably saying right now. Let's just skip the celiac testing and go straight to testing for gluten sensitivity. Well, things aren't as clear there as we would like them to be either. Yeah, I know this can be frustrating, and I wish there was a test I could point you to that would say yes or no when it comes to your ability to have gluten. And even going back to the research study that says we should follow a diet that's low in gluten, that really doesn't tell us how much we can have, if any. So let's talk about some of the pitfalls when it comes to testing and why it can get so confusing. Now, most of the time when people go and get tested for gluten sensitivity, they're getting tested for a single protein in the wheat molecule. It's called alpha-gliadin. So the reason that we are tested for that particular protein is because it is the most common protein that people will react to within the wheat complex. Unfortunately, not everyone reacts to that particular molecule. So if you go into your doctor and you want to get a test for gluten sensitivity, and your doctor runs an alpha-gliadin test, we should just be clear about what that means. If it comes back negative, it means that you're not sensitive to alpha-gliadin. But that doesn't mean that you don't have any sort of sensitivity or reactivity for the thousands of other proteins that are within the wheat molecule. The second flaw with testing is that we have different types of immune responses depending on the individual and depending on what we are reacting to. So we have these little proteins called immunoglobulins, and this is what your immune system makes to fend off different invaders, bugs like bacteria, viruses, and parasites. You can also create these for your food. And one of the common ones that people often think of is an IgE response, which is common for people who have severe responses to things like peanut allergies or bee stings. But most of the time when we're doing blood testing, we're not checking for IgE, we're checking for things like IgA and IgG. But again, we have to go back to that alpha-gliadin test and say, well, if we were checking for alpha-gliadin, what sort of reaction were we checking for? And in most cases, we are only checking for a single kind of immune response, potentially something like an IgG response. But if you, as an individual, being different than everyone else, don't have an IgG response, then that test will not come back positive. So again, we can have some issues here because if you have an IgA or an IgE response, you may think it's okay to eat gluten when in fact you just didn't do the right kind of testing. Lastly, we have to understand that food testing is not a complete science. And when we look at the review articles going over food testing, we see that using them as a single source of identifying food sensitivities is not a legitimate way to determine these things. So we again have to take things with a grain of salt and understand that just because the test says one thing doesn't mean that our body might be reacting in a way that isn't well interpreted by that test. Now I know that's a lot, but here's a quick little recap. The research is clear. It shows a strong correlation between gluten sensitivity and Hashimoto's. And when people take gluten out of their diet, we see improvements not only in their labs, but also in their symptoms. But when people go out into the real world and get tested, they don't always see that one-to-one relationship, which can totally be confusing. So what do? Do we trust the research, or do we trust the testing that we've had done at our doctor's office? That's the big question. Now maybe this is something that you didn't know the exact details of, but you were aware of the connection between Hashimoto's and gluten. So have you been testing taking gluten out of your diet, and what has your response been? Has it been positive or has it been negative? Let me know in the comments below. I always love to get your guys' feedback. But now that we know some of the big factors that can lead to confusion when it comes to Hashimoto's, autoimmunity, and food sensitivities, let's answer the big question. Should you, as an individual, be consuming gluten if you've been diagnosed with Hashimoto's? And I think that the answer is a resounding no. It is something that should be avoided. But there are a couple things that I'd like you to keep in mind. The first is that, remember when we talked about how not everybody with gluten sensitivity will develop celiac disease? Well, the same thing goes for our actual symptom response. A lot of people think that if they eat gluten and they don't have your traditional digestive cramping and bloating, then they should be fine. But everyone is going to have a different response. Some people may get neurological symptoms like dizziness, vertigo, brain fog, and fatigue. Other people may have skin rashing and itching. And of course, some people may have the digestive symptoms. But just because you're not in a single category doesn't mean that you're not necessarily having a response to gluten. You just might not be aware that that's what's going on. Additionally, not only can the location and type of symptom vary from person to person, but also the intensity. Some people will have large responses and some people will have small responses. But in either category, I kind of think of it like hitting your thumb with a hammer. Sometimes you hit it hard and sometimes you hit it soft. But over the long term, it's really something that we should avoid because eventually it will break us down to the point where our thyroid will not function like we want to. And in this scenario, we want to be proactive when it comes to our health. Lastly, incidental exposure of gluten in this day and age is almost a virtual certainty. But when that happens, don't stress about it. Some people become so panicked and so concerned that it makes it very difficult for them to navigate normal everyday life. And this is made worse by the fact that we've seen people talk about how gluten can be embedded in our gut lining and cause inflammation for up to 6 months. But that's not the case. The reason that we avoid gluten in general is because it allows our immune system to function more normally. Therefore, when we are exposed to gluten, when we are exposed to these kinds of stresses, our body can actually overcome it and it doesn't lead to a detriment in terms of symptomatic increase. But if we really want to know how we respond to gluten, here's what we do. We eliminate wheat products from our diet for 2 weeks and we observe how we feel. Now again, we can't just focus in on the digestive tract because gluten can have widespread implications for how we feel. So make sure you're assessing all facets of your health. Some people will notice a big difference right away and other people won't. But at the end of 2 weeks, what we want to do is journal our symptoms, document it, then reintroduce wheat into our diet and consume it multiple times a day for 2 to 3 days. What this does is it actually loads and stresses the system and will allow us to determine if any new symptoms crop up compared to our new baseline following the 2-week elimination. Although this can be a great way to figure out whether or not you react to gluten, I'd like to throw in a couple of caveats because nothing is 100% foolproof. And the first thing I want you to consider is that some people have multiple food sensitivities. So what this means is when we only take one food out of our diet, it can be hard to determine whether or not you feel better or worse with the elimination and then the eventual reintroduction. For those people, you may want to take a more broad-based approach and remove multiple foods at one time that are higher on the list of potential reactants. The second thing that I see a lot of is a lot of times when people go gluten-free, they start to consume a lot of gluten-free grains. So when you go to the grocery store, instead of grabbing the regular pizza, you grab the gluten-free pizza. But the problem here is that many of those grains look structurally similar to gluten, and so our immune system can actually react to either one. That means most people who have reactions to gluten will also react to one or multiple of those grains. So if we just swap gluten for something else that we also negatively respond to, it can make it very difficult for us to notice any changes or improvements as we're trying to assess the elimination phase. But here's the biggest key of all to the 2-week elimination. I want you to better understand how you feel with certain kinds of foods. If you can be more knowledgeable, then you can make better decisions. If we don't know how our body interacts, then it's very hard to determine what we should and shouldn't be eating. So if you've tested positive for Hashimoto's and you're continuing to consume gluten and wheat products, now is the time to start making some changes, testing how you feel, and support your thyroid health for the long term. After everything we've discussed today, I hope that you understand that gluten is a key food to avoid when we've been diagnosed with Hashimoto's. But there may be other foods that are problematic as well. If you're continuing to struggle with what sort of foods you should and shouldn't eat, go ahead and check out my dietary food guide. You can download it from the link in the description below, and you will have access to all the information you need for creating a new foundation for dietary health. If you like this video and have been enjoying my content, please hit the like button and subscribe to the channel. Additionally, share it with a friend or family member who might benefit from learning some of this information. Until next time, I'm Dr. Bodle. I'll see you in the next video, and I'm looking forward to talking with you guys real soon.